So my name is Neil Sahota. The good people at the ITU have nicknamed me the godfather of AI for good because this whole thing kind of got inspired by a speech, and I helped them kind of create this initiative 8 years ago. So it's really great to see how this has actually grown and evolved, and the community has really built up. But with that, I'd actually like to introduce our first speaker for this morning, Joanna Batstone. Professor Joanna Batstone is a global expert on AI, data analytics, and technology. She has more than 20 years experience in top executive roles in the United States, Europe, and Australia, helping universities, companies, and governments use technology to meet their goals. So Joanna is the inaugural director of the Monash Data Futures Institute, responsible for data science and AI across Monash University, supporting government, companies, and organizations in using data, AI, and insights for social good. So everybody please give her a very warm welcome as she shares her insights on using AI for healthy, inclusive, and thriving communities. Come on, Joanna. Thank you.
Thank you very much, Neil, and welcome to all of you. Thank you for joining us this morning. It's really delightful to be here representing Monash University and the Monash Data Futures Institute. And we've been proud sponsors of the AI for Good program here with the United Nations for the last 3 years. And it's great to be able to be here in person and share some of the work that we're doing at Monash University. Many of you in the last few days have asked me, where is Monash University? And so we have a delegation here from Monash today, and we're based in Australia. We're one of the largest Australian universities, and we have a very international footprint at Monash. Not only do we have campuses in Australia, but we have a presence across Southeast Asia as well, partnerships in India, China, a new campus in Indonesia, a campus in Malaysia. And for those of you who are in Europe thinking that Australia is a long way away, we also have a campus in Italy, in Prato, which is where we hold many of our European summits and opportunities for collaboration. Now, I have the privilege of leading the Monash Data Futures Institute, and this is a new institute that was established in 2020. I joined Monash after many years in a career in the big tech industry. And so my focus has been around how do we lift and amplify the conversation around AI for social good. And so with this new institute, we have a mission around how we can drive transformative change with data science and AI. And our research programs span many different areas and disciplines. The Institute represents over 500 researchers at Monash across all of our campuses. And importantly, it's very cross-disciplinary, very interdisciplinary, because we're focused not just on the traditional STEM disciplines, science and technology, engineering, maths, and medicine, but we're also really focused on how do we bring the world of the humanities, the arts and the social sciences, the law and education teams together to think about how we advance AI solutions for societal benefit. We have big partnerships in place, and one of the ways that we can engage in partnering across this big international university is through a number of programs that we've launched over the last couple of years, including an investment program with seed grants and a new international PhD program that has enabled us to bring students from around the world into our programs at Monash. So as part of this Data Futures Institute, one of the things that we do is to sponsor these interdisciplinary programs. And the focus of investments is really driven by the university's strategic plan. Last year, Monash University refreshed the strategic plan, and Impact 2030, the new strategic plan for the university, enables us to focus on big, dramatic, bold, scientific programs of research and investment. And we've got these 3 big global challenges that we identified as part of the strategic plan, which, as you can see from the titles of climate and geopolitical security and thriving communities, align so well with the focus that we have here around the Sustainable Development Goals. So in my presentation this morning, I'm going to use some examples of projects that we've invested in through our seed grant program that align particularly with thriving communities. And when we think about thriving communities, we're focused on living well, but also living well together. And we also have to recognize that for thriving communities, there are disadvantages and inequalities in the world in which we live. And so we're also focused on how can we bring new solutions to bear to address some of these inequalities or disadvantages that our communities face. So the first project I'll use as an example here spans across this discipline of the impact of climate change on the global population health burden. And so this is a piece of work led out from our Faculty of Medicine, Professor Yuming Go, who's looking at the impact of very small particulate grain smoke particles, PM2.5, very small particles, released during bushfires that have a very detrimental effect on human health. And so with this program, we're looking to do two things. We're looking to understand the dynamics of population health, mortality rates, the impact of bushfires on human health, maternal health. But we're also recognizing that in order to be able to do this effectively, we need to have much better monitoring tools and capabilities to be able to look at and model bushfire smoke around the world. We've seen dramatic increases in bushfires over the last few years. Right now, we've got bushfires in Canada that are forcing smoke down into the United States. In Australia in 2019 and 2020, we had some terrible bushfires in Australia. And so we've been using these events to enable us to improve our fire modeling estimation capabilities and bushfire smoke impact in the atmosphere, and then correlate that with the impact on human health. And so this is an example of the intersection between the changing world that we live in and the impact of climate change, but also in our ability to grow and be successful in our daily lives. The next couple of projects I'll use as an example of the work that we do around AI for good is in the context of human infertility. And so we know that this is a real problem. Over 186 million couples suffer from infertility and find it hard to conceive and bring a baby into the world. So one of the pieces of work that we've been doing here with Dr. Fabrizio Horta is to look at how can we use AI to improve the likelihood of a successful pregnancy outcome. And there are many ways to focus on leveraging AI, and we're focused on the image classification of the blastocyst embryo as it grows and becomes more implantable into the human being. But it's not just about the quality of the embryo, it's also about the dynamics of the patient history. And so we're looking at how do we use AI to model the patient clinical dimensions of age and maturity and infertility diagnoses, and then optimize for the ability for us to do the machine learning image classification to be able to select the appropriate embryo to improve the outcome of a successful birth. And so one of our goals here is to get to the point where an AI system of the future is a clinician assistant for the embryologist who is making a decision and can determine, for example, for the embryo on the left versus the embryo on the right, which is going to have the most likelihood of success for a successful pregnancy outcome. But infertility is not just about the embryo itself. We also need to be able to understand the dynamics of sperm selection in this process. And so another piece of work here with Dr. Reza Nosrati is looking at how can we use machine learning for sperm analysis in assisted reproduction. And today, this is a very manual process within the assisted reproduction clinics, and it's focused on looking at the morphology of the sperm head. And by using machine learning and analyzing massive amounts of data, we've been able to develop some techniques that enable our algorithms to really improve the accuracy of selection and hopefully the clinical outcome in the future as we look at normal morphologies and abnormal morphologies as we're looking at that selection process in assisted technology. So again, an example of if we can get this if we can get this right, it gives it the opportunity for automation of some of these processes really to improve human outcomes. So when we're successful, a new baby arrives. Unfortunately, not all babies survive. And particularly in lower and middle income countries, data from the World Health Organization told us that in 2018, 2.5 million newborns died. And a lot of the challenges with the newborn are around how do you assess the respiratory health of a newborn? And particularly for preterm babies, how do you monitor the vital signs of those babies? And so one of the pieces of work that we've been doing, and this is with Dr. Faye Masbanrad, is looking at both improvements in the handheld or wearable digital stethoscope that you can put onto the baby from a hardware perspective with sensors and monitoring, but also developing new software algorithms to enable us to monitor the respiratory health, evaluate cardiac health, by listening through the stethoscope with AI algorithms that enable us to improve the diagnosis of respiratory distress. And the focus on being able to do this as a wearable stethoscope is so that we can reach beyond the walls of our major nations and be able to take these technologies out into lower and middle income countries. So with the prototype here, we're really focused on how do we provide those real-time scores and evaluations so that non-expert users can make a diagnosis of a baby in need and make referral for treatment. Machine learning is often used for clinical decision support systems. But one of the challenges here is in the acceptance of a recommendation that an AI system makes in the doctor's office, and this interplay between the patient and the doctor and the recommendations. And so a piece of work that we've been doing recently with Dr. Patrick Kwan and our philosophy colleagues, Mark Howard and Rob Sparrow, is around understanding the sociological impacts of when you walk into a doctor's office, how do you as the individual feel that you can trust the recommendation that's coming from your doctor and from your machine learning system? And so with this particular program, we're looking at patients who have been newly diagnosed with epilepsy and using a machine learning system to make a recommendation on the first medication treatment for that patient with epilepsy, and then to look at how does that interplay of trust between the patient and the doctor change over time. It's a very trial and error process for many epilepsy patients to find the right medication, but we're looking at whether we can put a machine learning system together that eases that recommendation, but also alleviates some of the fear and uncertainty that patients have when they're thinking about an AI system making a recommendation for their health treatment. So those examples talk about AI for health. It's not just about preventing disease, it's not just about enabling wellness in the community, but thriving communities also mean that we need to understand some of the dynamics of communities and some of the disadvantages that people in our communities face as well. So one of the other projects that we've been focused on is around trying to understand what the public feels about disadvantage. And one of the things that's really clear is we're heavily influenced as individuals by what we read, by what we hear, by what we see, what we watch on television, what we hear on the radio. And so we've been focused on a program of work with the Paul Ramsay Foundation to look at how that narrative of disadvantage is communicated in the media. And so this is an example beyond machine vision of using massive amounts of data that we've produced from Australian news media, also Australian government reports, to be able to track over periods of time how a conversation around disadvantage evolves, and how a conversation around disadvantage shapes the policy and public personas of the people in government. And one of the really interesting things, the visualization on the lower left there, is from a large display panel that's installed in the Paul Ramsay Foundation's building in Darlinghurst in Sydney. And this is around enabling the community and the public to engage in the conversation and to explore how a narrative evolves over time. And one of the things that's really interesting is that you see the conversations change dramatically around dates in the year and major events like an election cycle or Australia Day, where there's a conversation that changes in the media around particular groups that experience more or less disadvantage. So this was a great example of a piece of work leveraging natural language processing really to gain insights into how do we think about disadvantage and how do we have the conversation in the media about disadvantage. Now, the next project I want to highlight, it's very topical for today's conference with AI for Good. It's great to see so many robots running around on the exhibition floor. But this is a piece of work that is being led by Shanti Sumatoho, who's with us here today, really to understand when we see a robot in public, how do we think about it? How do we feel about it? What do we think it actually does? The robot on the screen here is actually a robot that's recently shown up in one of our Monash libraries on campus. And one of the things that we've really realized through this research, which is very exploratory, looking at creative ways of thinking about the role of the robot in public, is that when we see a robot, we're very influenced by what we think it does based on the context of where we're finding it. And so this piece of work that Shanti's been leading, and she'd be happy to share more information with you after the session, is really to look at, from a design perspective, what are some of the policy implications as we start to put robots in public space. And so by leading a series of interdisciplinary workshops, looking at different creative methodologies for how do we design for the future, the guidance is very much around enabling the public to give us feedback on what does that future human-robot interaction experience look like as we start to bring robots into public space. What should small, medium, large towns, governments think about when they're putting regulations in place for robots in public space? And what does that future of the world of robotics mean in the context of a societal impact? Now, last but not least, I want to close by issuing to all of you a call to action. We've been, as I mentioned, proud sponsors of the AI for Good program for the last 3 years. And so we have a group of us from Monash University that are here for the next 2 days, and we'd love to meet you. So I'd just like to quickly introduce my colleagues before wrapping up. Andrea Colavecchio is our research director, also representing the Faculty of Science for the Institute. Chris Marsden, professor in our law faculty with a focus on AI regulations and governance. Shanti Sumatoho, that I just mentioned, from our art, design, and architecture team. Jesper Keldskov from our Faculty of IT. Claudia Del Campo, who's our operations manager and has really worked very hard with the ITU team to bring this work together. And then our media events marketing coordinator, Vijay Paul, that if you come to our booth down on the exhibition floor, you'll have the opportunity to meet us all. So thank you very much for this opportunity to present. Thank you, Neil. And we look forward to spending more time with you over the next 2 days. Thank you.